Well, first, healthcare, you think about healthcare, you're going to be faced with many patients who have various illnesses and injuries. So when you think about healthcare, you're going to be part of that healthcare team that you're going to be looking at trying to get that patient as far back, as much as independent as you possibly can, also getting them being as safe as they possibly can to overcome those impairments and disabilities that they have faced.
My story was when I was born, I was injured with forceps. And when I was in 3 years old, and then when I was in 4th grade, I had neck surgery, and I had to wear a brace, and it ran around my head, had a chin strap, a metal bar down my neck, and then metal bars down my chest and my back, and then straps. And kids aren't very nice in 4th grade when you have that. And a lot of people saw me as a cripple or as a person with disabilities, but my physical therapist saw me as a bright-eyed little kid, and that's all he saw. And I thought, wow, I want to be like that for other people. So I did a lot of science courses. I really loved that. So I think that's really important, because that's where you begin to find out, is this interesting? Because there's no area in healthcare that doesn't have science involved with it. If you're a phlebotomist, you have to know the veins. If you're a dietitian, you have to understand nutrition and diabetes and how food is absorbed. If you're a cardiovascular perfusionist, you have to understand physiology and physics, and it goes on and on.
It's very important to take sciences, math, advanced courses, chemistry, of course, because, like if you're going to be a pharmacist, chemistry is what you will be dealing with every day. So there's a lot of connections. Anatomy and physiology, that is actually a course that if you're going to go into any kind of healthcare, it doesn't matter if you're going to be a doctor, you've got to take that.
On this journey, you have to be comfortable learning and growing. But if you do these things, if you work hard, if you look to people and are curious for giving them the opportunity to help you, if you have a dream and you begin to look at how you can build that dream from people who have already achieved it, and if you're honest and loving and have integrity, I think that the world's your oyster. I think anybody can do any of those things in health science. And I believe in you. And personally, if I can help you, I will.
I was looking at probably the lowest paying job, and their annualized salary would be right at $17,000, and that would be like environmental services tech. And then the highest, of course, is physicians and things of that nature. It could be up to $1 million. It just depends on how long they're there, their specialty, many different factors. But in between, like if you were an RN and you come out with an associate's degree, you're going to start off around $45,000, $47,000 a year. The 18% is expected growth by 2026. We have needs in environmental services and our food nutrition areas, nursing assistants, monitor techs. There's just so many opportunities. And we do train in some of those areas. Our clinical areas are going to be RNs. I don't know that there'll ever be enough RNs. And that's one of the most vast careers you can have.
It's actually moving in a place where the health science role will be augmented. And the reason that is that those roles are paid well. They're not paid as high as a physician role, but the physician role is many times, and the high-skilled nurse role are many times doing work that is not their expertise. And so as we go through artificial intelligence coming into play and IT coming into play, what we're going to see is that human factor of that integration between ID and the patient, and the delivery, IT and the patient, and the delivery of care in the patient is going to be augmented with those roles. So I think this is like the absolute best time to go into those.
seeing that patient who couldn't walk, now they're up walking, seeing that patient who was just lying in the bed, getting bed sores, now they're up and they're going back to a job, things like that. So the number one point from a 10th grader standpoint would be money, but the number one point from once you get seasoned, I guess like I am, because now I'm an old man, would be satisfaction in life and helping people regain meaning to their life again.